I had never heard the word lifestyle medicine. I had been an endocrinologist for like 7 years, did not know that this was a discipline, a specialty, and found out that I could actually get board certified in it. And just taking that exam and discovering that body of literature about the 6 pillars and the science behind it, in a way I was angry that I had not read it before. I had not read it in my medical school, and I had not had the chance to apply it to myself. Had gone through 2 pregnancies, had been taking care of patients, but been completely blind to the science that has existed. Type 2 diabetes can feel like a punishment to the person who's suffering from it because it's there every single moment of every single day of your life. But it's something that can go in remission if people are able to make drastic changes to their lifestyle. It's not about managing type 2 diabetes. It's not about, living with diabetes. This is about really seizing control of diabetes and putting it in remission. Michael actually came to me, I think it was 4 or 5 years ago, and he had such a powerful story. One of the most powerful stories I'd ever heard. He had been getting sick at least 2 or 3 times a year. He would go down with pneumonia after pneumonia multiple times a year. He would be hospitalized at least 2 times a year, maybe 3 times a year, would be there for a week or so, and then, doing rehab for weeks after that. So that was his life.
What led me to change my lifestyle, after really being, I guess the word would be afflicted with both coronary heart disease and type 2 diabetes, was after I'd returned from a wedding. I caught a cold, which led to me becoming very ill. It became double pneumonia, and then it necronized. And I never even heard of these words, but I certainly felt it. Double pneumonia is no joke. When it's necronized, it's extraordinarily painful. I was very ill. I was bedridden, couldn't move, couldn't get up, and I couldn't sleep much. So you do a lot of thinking. And I just thought, am I going to just keep repeating this? Is this what I get for the rest of my life? The attending doctor came through. He told me, unfortunately, I would also have to have 2 more heart stents on top of what I just went through. And I'm thinking, oh God, really? And then he said, yeah, but you might need a bypass after that. That was enough for me to really think, got to do the changes. I still am very invested in life.
Somehow it clicked for him. He decided to just go all in, and he was able to make a huge change in his health with the diet change, but at the same time understanding the other pillars, sleep particularly, and then stress management. That was it. That was the last time he ever went to a hospital.
I learned the hard way, but I learned it well. You always have to bear down on the reality of your condition, realize that you can get it in way better control than you thought, but I gotta walk out of the office and I gotta own it. My diabetes was irresponsibly high. It was 12 up to 14 on the A1C scale.
Over the last few years that I have known him, his A1C has typically been less than 6.5, which is officially defined as remission. He's an inspiration to me.
I found Dr. Gulati because she was highly recommended. And one of the things that really attracted me, and it was a happy surprise, was that Dr. Gulati is board certified in lifestyle medicine. And there's not that many. That's a wonderful, wonderful resource for somebody to have.
Prescribing lifestyle medicine has actually enabled me to be a mirror for them, to bring them face to face with the power that they have. Patients can actually find that empowerment that no drug can bring you. You cannot pop a pill for that. Now I look forward to getting up from bed every day, and I think my work matters. I actually am able to tell my patients to do more than just, take 2 extra units of insulin. And now the journey is the destination, and it feels more fulfilling.